Major decision from the U.S. Supreme Court today paves the way for states to cut off Medicaid funding to Planned Parenthood.
In South Carolina, where this case originated from, there are just 2 Planned Parenthood clinics statewide, but this could have implications across the country on Planned Parenthood clinics in both red and blue states.
Yeah, tonight we do have team coverage spanning across the nation. Cassie Simeon is in Washington, D.C., but first we're being joined live by our Maciel Leyva, who's learning about Maciel concerns here in Central Florida.
Good evening, Tammy and Curtis. I spoke with Representative Anna Eskamani, who shares that she's a former employee of Planned Parenthood, and she shared her concerns about thousands of Americans who turn to the organization as their main provider of health care. I also had an opportunity to speak with a health law professor who shared her thoughts on the future of women's health. The Supreme Court issued a ruling on Thursday paving the way for states to cut off Medicaid funding to Planned Parenthood.
I'm concerned about women's health services being provided throughout the United States after this ruling.
The 6-3 opinion comes in a case that wasn't directly about abortion. Planned Parenthood also provides services like contraception, cancer screenings, and pregnancy testing.
That's going to mean a lot of people, poor people that need Medicaid services, are not going to be able to get these kinds of women's health services. And as it is, it's hard to find providers that take Medicaid. And so that's one of the reasons that Planned Parenthood kind of fills this gap in healthcare services.
Representative Anna Eskamani says the decision could impact patients not only in South Carolina, but across the country at a time that's already difficult to access basic reproductive care.
It's not funding for Planned Parenthood, it's funding for patients and their options to seek care. And stripping away the ability for the nation's leading provider of reproductive health education advocacy to receive patients on Medicaid is devastating.
The ruling could have broader implications for Medicaid patients because it blocks them from suing to make sure they can visit the provider they choose. Eskamani says she's especially concerned about the people who live in rural areas with limited healthcare access.
Even in Florida, when we look at counties like Polk County, there's only 1 Planned Parenthood there in Lakeland, and it is non-abortion provider historically. It primarily serves folks with contraception, STI testing and treatment, cancer screenings. It's those types of health centers are going to close first.
We did reach out to Planned Parenthood of Southwest and Central Florida for comment, and in a statement they said this ruling does not have a, quote, immediate effect on affiliates outside of South Carolina. However, we also obtained a statement from the company that says that other states could move to block people with Medicaid coverage from going to healthcare providers for political reasons. Reporting live in Orlando, Maciel Leyva, Spectrum News.